Hello, I'm Dr. Michael Gorman, TPI Certified Physical Therapist and founder of iMove Golf. Did you know that over 80% of Americans experience low back pain in their lifetime? Well, this tells me that over 80% of golfers will more than likely experience low back pain as well. This pain can get so bad to the point where it can actually force the golfer off the course. But it's important to know that the location of the pain may not always be the cause of the pain. So today we're going to talk about the body swing connection regarding the mid-back as I show you the seated thoracic rotation test. Okay, so let's move forward with the seated thoracic rotation test. You will take two golf clubs and put them at a 90-degree angle to each other. You're then going to take the 90-degree angle and rotate it and put this right on the floor. So you still got the 90-degree angle on the floor and your feet are right against that 90-degree angle. We need to take a third club. You're going to have your feet together, knees together. This third club is going to go right behind your neck. You're going to lightly hold the club. You're not going to force your head and neck forward. It's important when you're doing this test, you must keep your feet and knees together, and then you're going to rotate to the right as far as you can without pain and with those knees staying together, and then you're going to rotate to the left. What we're looking to do with this test is we're looking for at least 45 to 50 degrees of rotation to each side. That's why we have the clubs on the floor as they are, because you can look down at the club and you can see if your shoulder turn is at least 45 degrees. Now, if you're restricted either to right or left, what can we do about that? Well, there's many things you can do about it. Right now I'm going to show you one exercise that you can do. You can do this exercise on the driving range before you tee off on the first hole, but one exercise that's very helpful to increase the mobility of the middle back. We know that, say, we're restricted rotation to the right. Well, what can we do about that? This exercise is called an A-frame stretch. What I want you to do is have your feet a little bit more than shoulder width apart. Your knees really, for the most part now, are pretty straight, maybe slightly bent. Arms are going to be crossed on your chest, and then while you're keeping your spine tall, you're just hinging through your hips. You're hinging through your hips, you're coming forward. Okay, you're keeping your spine straight. Going to have a slight bend in your knees now, so almost like you're in your golf position. Then what we want to do is take the inside of the left elbow, put it up into the inside of your knee, and the left hand will just brace the other knee. You're going to take your right arm. If we want to increase rotation to the right, we're here, and we rotate our arm up and down. So this is increasing rotation of the middle back, which is called your thoracic spine, to the right. Always want to keep exercise pain-free. Today we talked about the lower back pain that one might have, but we talked about the lower back pain as it may not be the cause of the problem. We did a TPI test, which is called the seated trunk rotation test, to determine if your middle back, if your thoracic spine lacked the mobility that it should have. Because if you lack mobility of the thoracic spine, as you rotate, more stress will be placed on the lower back and you will have compensations in your golf swing. If you'd like to learn more about the body swing connection and what a TPI Certified Physical Therapist can do for you, please reach out to me. My email address is mgorman@iMoveTelept.com, or you can go to my website, www.iMoveTelept.com. See you on the first tee.